Hi everybody, in this video we are going to discuss about the symptoms, treatment and prevention for the disease called as Ascariasis. So in the previous video we studied about the life history and the development of the disease called as Ascariasis, and we understood that this disease called as Ascariasis is caused by a pathogen. It is caused by a pathogen which is called as what? Ascaris lumbricoides. Okay, Ascaris lumbricoides. This is the name of the pathogen which causes a disease called as what? Ascariasis. Okay, Ascaris lumbricoides is the pathogen which is causing the disease called as Ascariasis. And this Ascaris lumbricoides is an endoparasite. Okay, it is an endoparasite. What do you mean by endoparasite? Endoparasite means which is living inside the body of a host. Inside the body of a host. So here we have to remember that this is an endoparasite. What is the host here? What is the host that is used by the Ascaris lumbricoides? The host that is used is here the humans. Okay, host is the humans. And here one more point, and a very important point we have to keep in mind, is that Ascaris lumbricoides is known as the monogenetic. So you know the word, the meaning of the word monogenetic. Monogenetic means what? A pathogen which is completing its whole life cycle within one host only. It will not be using two hosts. And we know if a pathogen is using two hosts to complete its life cycle, we use another word called as what? The digenetic. We use another word called as digenetic. But here we have to remember that Ascaris lumbricoides is monogenetic. It is monogenetic. It is not what? Digenetic. Please remember it is not digenetic. Please remember it as monogenetic. So here Ascaris lumbricoides, which is endoparasite, means what? It is living inside the body of an organism. Where it lives is the main point. It is there present in the digestive system. It is there present in the digestive system, we say. Mainly, which part of the digestive system this particular pathogen will be infecting? It will be infecting the small intestine. A very important point. Okay, small intestine. So small intestine is being damaged, or it is the place where the Ascaris lumbricoids will be multiplying, completing its life cycle, causing which disease? Ascariasis. So these are all simple points that we have to keep in mind when we are talking about the disease Ascariasis. Immediately these points should come into our mind when we discuss about the disease called as Ascariasis. Now, once it is present inside the body, or inside the digestive system in this small intestine, what are the symptoms that it will show? What are the symptoms that it will show? We are going to see now. So here the symptoms, if you are looking at the symptoms, the first and the very primemost thing is that it will obstruct the intestinal passage. It will obstruct the intestinal passage. But before we see these symptoms, the another point which is very, very important is that this particular Ascaris lumbricoides is carried into the body. Okay, it is carried into the body or transmitted or transferred into the body through what? Through the contaminated food. Okay, through the contaminated food. Okay, and drinking contaminated water It is by this the particular pathogen which we are calling it as Ascaris lumbricoides enters inside into our body. Once it enters inside into the body, now it will obstruct the intestinal passage. Why it is obstructing the intestinal passage? It's because when it starts multiplying, it will be so high, the number of these Ascaris lumbricoids will be they will be more in number, so much in number that they will completely occupy the small intestine. They will be obstructing the small intestine. Completely they will block the small intestine. Why? Because they are now adults. Ascaris lumbricoides, they develop and become adults, mature and develop into adults. So these adult worms will be blocking the small intestine. So that's what we are saying, obstructs the intestinal passage. So that is the first symptom we say, obstructing the intestinal passage. It is because there are many adult worms of Ascariasis lumbricoides present in the small intestine. Because of the obstruction of the intestine, immediately it leads to abdominal discomforts, means abdominal pain. Abdominal pain, which we call it as what? Colic pain. They will have the abdominal pain, colic pain we call it as. So, because of the obstruction of the intestinal passage, there is abdominal discomfort called as the colic pain. So, when there is no movement of the food, because it is blocked by what? Ascariasis lumbricoids, it can lead to what now? Indigestion. The digestion process will not be taking place as normally. Okay, normally the digestion will not be taking place as it should be, and it also can lead to what? Diarrhea. Okay, diarrhea. Because there is no digestion of food, improper digestion is taking place, which will be leading to what now? Diarrhea. And because the digestion is not taking place properly, it can also lead to vomiting. Because the food is not passed. Because it is obstructed by what? The Ascariasis lumbricoids. So that's why it will be that particular individual or that particular he or she will be vomiting the food because of what? It is linked with what? Indigestion. And when this disease is so severe, it can also lead to nutritional deficiency. As we all know that the more nutrients will be absorbed from the small intestine here, but we have to remember that the small intestine is blocked by what? Ascariasis lumbricoids. So when it is totally obstructed by the Ascariasis lumbricoids, say suppose if this is the small intestine, the worms will be many in number, male and female worms will be many in number, completely blocking what? The small intestine. So there is no even absorption of the nutrients also. So that particular individual, especially this is seen in the children. So because we already said that they will be having the habit of eating soil. Okay, they will be having the habit of eating soil. So in such children, what happens is that there will be nutritional deficiency because the nutrients cannot be absorbed from the small intestine, and it also can lead to stunted growth. Please remember these two, okay, will be the symptoms in severe cases of Ascariasis. There will be nutritional deficiency, and as well as the child will be showing stunted growth. Means what? The growth will be not, there will be no normal growth. The child will be very short and development will be very slow. So that is called as what? Stunted growth. It's all because of what? Nutrients are not being supplied to the body. So the child will be suffering with stunted growth. So these are some of the symptoms. That we have to keep in mind when we are talking about the Ascariasis. How to identify this disease, that he or she is suffering with this particular disease. And now, if you are seeing the treatment and prevention, here there are anti-helminthic drugs. Okay, there are anti-helminthic drugs which are used against the worms. Okay, anti-helminthic drugs we call them as. And some of those anti-helminthic drugs that can be used to treat, in order to treat this disease called as Ascariasis, is the best one, that is oil of chinopodium. Is the treatment, that is, it is used as treatment or a drug to treat the disease called as Ascariasis, oil of chinopodium. Otherwise, there is another one called as Agopar. Okay, Agopar is another drug. Bandex, Dewormies, Zental, okay, and mebendazole. Mebendazole is choice drug we say. It is a choice drug we say. Only if it is required they will be using, because they can be addicted for this drug. So it is a choice of drug we call. So at the same time, the parents should be very much aware about their children that they do not take the habit of eating soil. They do not take the habit of eating soil. So parents should be very cautious that their children are not having the habit of what? Eating soil. Why? It's simple that in the soil only these worms will be present. Okay? As in the form of what? Embryonated eggs. As in the form of embryonated eggs, they will be present in the soil. Because it is all because of what? There are many people who will defecate. They will be defecating the outside in the public places. So when this stool, okay, or the feces, okay, when the feces consists of what? The embryonated egg, there are chances that this can be carried by the mechanical vectors or through drinking contaminated water, or the food which is visited by the mechanical vectors can carry these embryonated eggs, and they may drop on the food which is freshly prepared. So then they may be entering into our body. That is one way. And otherwise, directly when the children are playing in the soil which is contaminated with what? The embryonated eggs of Ascariasis lumbricoids, then there are chances that those children may suffer with this disease called as Ascariasis. And in some cases it is so severe that, as we said, they obstruct the intestinal passage, and they may be going through the defecation also. They may be releasing these worms also. They will be eliminating these worms also, and very severe cases these worms may be vomited also through the mouth, which is very, very dangerous. So these are some points that we have to keep in mind when we talk about the Ascariasis symptoms, treatment and prevention. So here are the symptoms which were, so when the disease becomes so severe, what is happening? There will be many adult worms, male and female worms, which will be obstructing the intestine, and that's why there will be severe discomfort, which we are calling as colic pain, and it leads to indigestion, diarrhea, vomiting, and in severe cases it is leading to what? Nutritional deficiency in children, and it can also lead to stunted growth. So these are the symptoms. Knowing the symptoms, we can go for treatment and prevention. What is like? Using oil of chinopodium, alcopar, Bendex, deworming, Zental, mebendazole, which is choice of drug. We are saying choice of drug. Please remember this. This is choice of drug, and the very simple prophylaxis. Okay, the very simple prophylaxis that every parent should follow is what? Do not take the habit of eating soil. Means what? They should not be allowed to have the habit of eating soil. They should not be allowed to have the habit of eating soil, because that soil, if it is contaminated with the fecal matter consisting of the embryonated egg of the Ascariasis lumbricoids, then the children may suffer with this disease, or otherwise it may be because of drinking contaminated water, or maybe because of eating contaminated food. So these are points that we have to keep in mind when we are discussing about the Ascariasis, the symptoms, treatment and prevention. Thank you so much. We will meet in the next video.